Hello, I'm Dr. Guy Yatros from Dental Sleep Solutions and DS3, and welcome to this edition of Dental Sleep Medicine Insider. Today I'd like to talk about patient objections. We teach a lot of courses and educate a lot of dentists on dental sleep, and oftentimes they're excited to get involved in dental sleep, but then they go back to their offices and are met with challenges from their patients to sleep testing or treating for dental sleep. So we'd like to talk about what we do when our patients object. First of all, what is an objection? An objection can be defined as the action of challenging or disagreeing with something. So when we think about our patients disagreeing with what we're talking about, what are they really saying? Are they saying they don't want to be healthy? Are they saying they don't want to breathe better at night? Are they saying that they don't care if they're going to have a heart attack or a stroke at night? Oftentimes what they're saying is just the tip of the iceberg. It's what's at the top and what they're saying to you, when really the meaning of why they're objecting is underneath. And we have to dig deeper to be able to challenge these patients when they have objections. So you have a patient that comes in and you're screening them for obstructive sleep apnea, and the patient's in to have their teeth cleaned, and they just say, I just want to have my teeth cleaned. I'm just here for that. And we know that a lot of offices fail to get their patients tested as we educate them, and we know that 1 in 4, maybe 1 in 5 adults at the least has apnea, but why aren't we testing a lot of patients? We should be testing a lot of patients. When we bring up the sleep test, the patients have a reason that they say no, and the offices just go on about their daily business. Maybe we think it's money. Sometimes we think, well, our patients can't afford the treatment, or they object to the cost of the sleep test or the cost of the treatment. And we think, well, that's it. The patients can't afford this. Or sometimes maybe they'll say bite changes, or maybe it's inside of us as our dentist offices that we're concerned about those bite changes and the side effects, and maybe that prohibits us from succeeding. So I want to make this simple, but it's really very simple, but it has to be on you and your offices and your philosophy. When you're talking to your patients, the patient's objections will be readily met if you believe in what you're doing. I mean, I started to put this video together and give you specific verbal skills, and those have very little to do with getting your patients to say yes to sleep testing and treating for dental sleep. It has to do with us inside and our team and our philosophy, and how much we believe in what we're doing, how well prepared we are for this. And if we believe in this, and we believe it's our job, we believe that if we let that patient leave and we don't talk to them about sleep apnea and getting tested, that it's just like not doing periodontal probing. So it starts with that. We have to be prepared as part of it. We have to know how to get them sleep tested. We have to know how to treat them if they're already sleep tested and we're talking to them about treatment. And ultimately, it comes down to the patient's trusting us. So, we could give you lots of verbal skills on how to do this, but if you sincerely as a team in your offices believe that my job as a dentist is to make sure that that patient who's at risk for sleep disorder breathing gets a sleep test somehow. And if they have apnea, and they can't wear CPAP or don't want to, that a dental device is what is needed. And we believe it, and we're confident that we can do this, then our patients will say yes to treatment, and we will be helping these patients live better and live longer. It really comes down to something I read not too long ago. And we're not selling things here, but we really want our patients to believe in us and to go forward with the treatment we think is necessary. And the reason patients say no is, again, not because of what we say. It's because of what we believe. And I read this statement recently that people don't buy what they sell, they buy what you believe. If you and your offices believe that sleep disorder breathing, treating our patients for apnea and snoring, and getting our patients tested and making this a part of our job as dentists, then the rest will become very easy. You'll help your patients live better, live longer, and at the same time you'll increase your practice income. Well, I hope this has been helpful. Thanks for tuning in to this edition of Dental Sleep Medicine Insider Magazine. Again, I'm Dr. Guy Yatros from Dental Sleep Solutions and DS3.